I'm Dr. Peter Lewis from SureCell, and today I want to talk to you about prolactin. We're seeing a lot of people coming to us with fatigue and tiredness, and one of the causes of this is the hormone prolactin being present in excessive doses, particularly in males, but sometimes in women. Normally, males shouldn't have any significant amount of prolactin in the system because the role of prolactin is to make breast milk. But what we're seeing is that some people with elevated prolactin are suffering from fatigue, tiredness, loss of libido. A lot of people, when they have fatigue, make an assumption that the problem is low testosterone levels. And indeed, sometimes it is. And we've been seeing way more low testosterone than we've ever seen before. But in some people, the testosterone levels are normal or even occasionally elevated, and this is associated with elevated prolactin causing tiredness. It's normally extremely rare for men to have elevated prolactin, and it's often associated with a tumour called a prolactinoma. But the incidence of this is about 1 in 10,000 people. So the average doctor would see this about once every 10 years. Now, I'm seeing up to 4 people a day suffering from elevated prolactin. Now, this is a post-COVID phenomenon, and up to 10% of people who suffer severe COVID end up with increased prolactin afterwards, and this is not normal. And it's being missed because very few doctors ever test their patients' prolactin levels. We know why this is happening. The spike proteins that are associated with COVID are crossing the blood-brain barrier. We've been aware of that from very early on in the COVID pandemic when we heard that people were losing their sense of smell. Now, that loss of sense of smell is happening in the frontal lobe of the brain, the primitive part of the brain that controls primitive things like our hormones. This area is also alongside the area where we have short-term memory. In fact, a lot of people are aware of the connection between memory and smell. Well, hormone regulation also comes from this area of the brain. What's happening is that because of the damage, the body's thermostat that regulates prolactin is actually damaged. So we actually think in the brain that there's not enough prolactin, and the body then releases excess prolactin to compensate. Now, this sometimes goes away by itself, and we monitor people. We never treat someone just on the basis of a one-off prolactin, because prolactin can vary, just like Melbourne weather or the stock market. It goes up and down. But repeatedly elevated prolactins are something that we need to do something about. Many of our patients actually get better by themselves over a period of about 3 months. But some cases need intervention. And in that case, we'll use a hormone blocker called cabergoline, which often resolves the symptoms and the quality of life improves very quickly. And cabergoline is very safe. My concern is the future, because we're seeing so many people affected like this. Many people are going undiagnosed because no one's thinking to test for it. And I'm concerned that there's so little discussion in the media or even amongst doctors. And yet there are published papers showing that in many studies there are elevated prolactin levels post-COVID. My advice, of course, is to try to avoid catching COVID in the first place. And we all need to do more to make sure we're not at high risk of exposure. Because I'm frankly concerned what's going to happen in the future, particularly with very young people, if their brains are repeatedly exposed to this sort of trauma. Thank you.